Hello, I'm Dr. Christina Hassija from California State University, San Bernardino, and I'm going to be talking to you today about the use of video conferencing in psychotherapy. So, video conferencing in psychotherapy is defined as an innovative technological medium that allows individuals to communicate securely with access to both visual and auditory information through a computer monitor or video screen in real time. So this technology has actually been available for quite some time and has been used in medical and mental health settings for over 20 years. However, it wasn't until recently during the coronavirus pandemic, where video conferencing really became widely used and relied upon as, in some cases, the sole means to provide mental health services. In the past, video conferencing has been an innovative solution to trying to connect clients to services, particularly clients in rural and other geographic restrictive settings, to connect clients to specialists. So perhaps if a client needs a specific evidence-based treatment, say for post-traumatic stress disorder or anxiety disorder, video conferencing can enable them to, be connected to somebody that has extensive training in really specialized interventions. And it also provided an opportunity for service delivery with fewer logistical barriers, such as transportation, time to travel, and cost to travel, etc. So it really was an innovative solution to particularly individuals in rural locations. And that was really where my first experience with video conferencing came from. I actually am a clinical psychologist, and my area of expertise is within trauma and post-traumatic stress disorder. And I attended graduate school in a very rural part of the United States. And we established one of the first video conferencing based clinics nationally. And the goal was really to connect, individuals from rural domestic violence and rape crisis centers to practitioners that were trained in evidence-based treatments for PTSD. And, video conferencing has actually been studied and utilized a lot, particularly among trauma populations, such as with the Veterans Administration. However, prior to COVID, you weren't necessarily seeing it used widely in kind of regular routine practice. But of course, during the times of COVID, it became a completely vital tool to ensure that people could still continue to receive their care and to do so safely while we were following, physical distancing protocols. And, of course, now some of those protocols have eased and a bit, and now people, are able to, in many settings, resume in-person psychotherapy. But I think that for a number of individuals, both clients and providers, we are going to continue to see, increased reliance on, video conferencing, particularly because of its, kind of utility and convenience. So let's talk a little bit about some of what we know about the effectiveness of video conferencing. So because it has been around for quite some time, it actually has been well studied, and it has been shown to be an efficacious treatment modality. And there have been a few different reviews, studies that have basically concluded that, video conferencing is no less efficacious than standard face-to-face therapy. So specifically when we do non-inferiority trials and try to determine whether face-to-face is basically equally efficacious to in-person treatment, the studies generally indicate that that's the case. In addition, clients and providers have both been shown to report comparable levels of satisfaction across face-to-face and video conferencing therapy. And video conferencing has also been shown to be an effective modality to implement a variety of evidence-based treatments for specialized mental health conditions such as PTSD and depression. So there's a very wide body of literature kind of looking at the utility of video conferencing to implement evidence-based treatments such as cognitive behavioral therapy for depression, prolonged exposure, and cognitive processing therapy for PTSD. And generally what the research shows is that the efficacy of interventions are not impacted when they're supplied via video conferencing. And there does seem to be generally, comparable levels of satisfaction. So there's a couple of different models for providing video conferencing therapy. So there's a couple of different types of ways in which settings have implemented and offered this type of service. One type is the hub and spoke model. And I think that this was kind of an earlier method of video conferencing treatment delivery. And the hub and spoke model is basically a situation where, you have the provider, say the therapist, located in a healthcare facility, and they meet with the client through video conferencing technology, and the client is located at another kind of remote clinic. So it's very similar to what I described to you earlier, which was my first experience with video conferencing, where, I was working in a counseling clinic, and the clients were presenting at rural domestic violence and rape crisis centers, and they would access the video conferencing there, and there would be staff on the other end available to provide assistance and support. What followed, even prior to COVID, the other method is home-based video conferencing, and that is basically where the patient and or provider could potentially be located at home and be receiving or providing therapy from that location. And so these are kind of the general models, and there's kind of pros and cons, I think, to both. But they have been done successfully in both ways. Irrespective of where the service is being provided, there are certain technology needs. One, I think the most important consideration is that, whatever technology that you're using to provide the service needs to be compliant with whatever the jurisdictional privacy and data security standards are. So whether that is set forth by your organization or the state or nationally, you want to make sure that your technology meets those needs. It can also, video conferencing can be provided via the use of a video conferencing unit, like a specific Polycom machine that is, set up and basically the sole utility of that machine is to, provide video conferencing services. Or what you see more recently now is that with the use of a webcam on a laptop or a PC, a person can, provide the service that way. Of course, there's also tablets and smartphones that are equipped with cameras and the technology to provide video conferencing. In terms of software, there's a number of different software that are kind of readily available. Again, I think the most important consideration is making sure that whatever platform you use is going to meet the required privacy and data security standards. So there's of course, many people are very familiar with Zoom now in the post-COVID world. And I know that Zoom does have some add-on packages that are specifically meant for, kind of medical, kind of scenarios where you need to ensure, strong security and confidentiality. And then, of course, also, there are services like FaceTime or Skype. And I think, obviously, when you're choosing a platform, you want to definitely keep in mind, what's going to provide the most reliable and most safe and secure connection. And so it's important to, kind of do your homework and see what options are available. Early on into the COVID pandemic, I don't think, many providers had really kind of had the opportunity to kind of research, and there's been kind of a proliferation of services, aimed at kind of providing safe and secure video conferencing. But even, ensuring that if you're using one of these, more readily available platforms, that you're, creating the proper security settings. So perhaps setting up a Zoom, a wait room, or something of that sort. And then, of course, you're going to want to make sure that you have a strong internet connection. That's going to be obviously critically important. I think, video conferencing can be, very comparable to face-to-face services. But of course, if you have a choppy connection or a connection that cuts out, it's obviously going to, can potentially interfere with service delivery. So you do want to make sure that you're set up to a good internet connection. I think generally, if you can be directly connected to the internet as opposed to using like a hotspot, that generally tends to ensure, better connectivity. When you're considering providing video conferencing services to clients, there are some considerations you want to keep in mind. However, according to the American Telemedicine Association and the American Psychiatric Association's best practice guidelines, there aren't really any clear absolute contraindications to patients being assessed or treated video conferencing. So for the most part, this is a reasonable mode of treatment for the majority of individuals, which is great. However, it is still important for the provider to still make sure that a client is suitable for video conferencing services. And so some of the considerations you want to take into account include the client's cognitive capacity. So are they technologically proficient? Are they able to successfully connect or disconnect? If they're having to send other electronic materials to you, such as homework or forms, are they able to do that? Do they have a history of being cooperative with treatment? Obviously, if there have been other issues with them receiving their face-to-face treatment, or there's been numbers of behaviors that kind of interfere with therapy, you want to obviously consider whether or not, those issues would still present an issue if you're providing services via video conferencing. Of course, clients that are at risk of, harm to self or others, so those with, self-injurious behavior, suicidal or homicidal thoughts, those are situations where you want to assess carefully, a client's suitability for video conferencing services. And I'll come back to that and provide a little more information on that in a moment. In addition, you want to consider whether there's any medical aspects of their care that require an in-person medical exam. Obviously, via video conferencing, you do have access to, visual material, like you can, see, a person's nonverbal kind of behaviors. You can see their facial expressions, but you're not necessarily, obviously, of course, going to have access to perform any kind of medical exam or physical exam. So if a person does need that kind of care, then, of course, video conferencing would not be a good alternative. And then I think it's always good to consider, should a client no longer become suitable for video conferencing before you take them on, I think it's important to consider what other alternatives there are and to share those with the client so that it's very clear, what the kind of plan B would be, if the treatment didn't seem to be, able to continue remotely. There are, of course, a number of ethical and legal considerations that a provider wants to take into account prior to engaging in video conferencing. And these are going to vary depending on the provider's jurisdiction. So you want to make sure that you check with the local legal and practical guidelines, whether those again are provided by the state or the organization that you work for, or the overarching professional organizations. One of the biggest concerns, really is, client privacy and confidentiality. And so it's really important that you ensure that the care that you're providing still meets those standards. Another ethical and legal consideration is kind of where you're providing the service. Depending on the state practical guidelines, a practitioner may or may not need to be licensed in the same location where the client is receiving the services. And so even in the United States, that is something that varies state to state. Some states require that providers be licensed in the same state where the client is receiving services. Some do not. So it's really important to do your homework ahead of time and ensure that you are engaging in work that is practically and legally allowable. Another consideration is that prior to COVID-19, not every state or national, healthcare provider, was able to receive services remotely and be reimbursed for those services. So it's really, again, important to do your homework to ensure that, whoever is going to be providing the compensation for this service, deems that video conferencing services are allowable. And then finally, again, data privacy and security, which I mentioned. So making sure that you are meeting the requirements set by licensing boards and national organizations regarding, the clients, so that the client's best interests are protected. Some other considerations you might want to think about prior to engaging in video conferencing psychotherapy is one, it's always really helpful to establish an emergency contact and to obtain a release of information from the client at the outset. So, and this is important, especially when you're not following that kind of hub and spoke model, or you're providing kind of in-home based services. You want to make sure that there's somebody on the other end, that if there is an emergency scenario, perhaps the client becomes actively suicidal or homicidal, or there's some kind of medical issue or injury that comes up, that there's somebody that you can contact on the other end to connect the person to emergency personnel. So, usually how I do this with my clients is I'll just, basically ask them to provide me the name and phone number of an emergency contact, and I'll also obtain a release of information so that if something happens, I can call this person and disclose that I'm, seeing my client, and that I can describe to them what the emergency issue is, and that they can, effectively respond. So that is critically important. In addition, especially when you're providing remote care, I think sometimes it might be tempting to, just, kind of provide care to anybody that's potentially interested, but it's really important that you make sure that you have at least some basic knowledge and access to local emergency information in the area. So, because if an emergency situation arises, you might need to be able to, you want to be able to very quickly potentially contact law enforcement or local hospitals or other local providers that can step in if there's a situation that arises. So I always recommend that providers, really kind of do some background research in the surrounding area of the clients that they're seeing, so that they kind of readily can pull this information and have access to additional support should they need it. I think when you're working in kind of more of a hub and spoke model, so maybe where a client is showing up at a smaller clinic or some other kind of setting where there's other individuals in the background, those are situations where, obviously you have somebody else that has kind of, boots on the ground that can kind of step in or assist if necessary. But especially when you're providing home-based care, it's really critical that you know where you're Zooming with the client from, what their location is, what their phone number is, who the emergency contact is, and again, local resources. It's also really important to establish a backup plan for connectivity should issues arise. So I always discuss with my clients, what the plan is if the session somehow becomes interrupted, maybe the internet goes out or there's a poor connection, how are you going to reconnect? And so, usually the most feasible option as a backup is using the telephone. So, I'll always make it really clear that that's what we do. Should somebody become disconnected or should we lose connection? And then of course you always want to make sure that, you have the correct contact information for your client, and vice versa. Another important consideration is, as you're kind of working and providing psychotherapy to clients, it's really, important to kind of be able to still engage in some of those routine methods of assessment that you do with in-person care, and also be able to still implement parts of interventions that you do when you're, providing services face to face. So what I'm talking about specifically is, basically being able to, have a way to exchange information with the client securely. So many times, obviously in psychotherapy, completing homework assignments is an important piece of some interventions, as well as engaging in routine symptom monitoring. So it's really important that you, are thoughtful at the outset about how you're going to exchange these kinds of information with the client, and how you're going to ensure that whatever you're exchanging with them is going to be kept as safe and secure as possible. So, historically, I think a lot of providers that offered services via video conferencing, tended to rely a lot on fax transmission because it was a little bit more secure of a modality than email. I think now, obviously, there are a lot of programs available that you can, pay a small fee or sign up for that can allow you to provide, safe and encrypted communication via email or otherwise. So I think, doing your homework and kind of looking at what might be the best mode for you and your client, and then, determining at the outset, what you're going to use. Another really important piece is informed consent. So we always do informed consent with our clients at the outset of therapy, discussing the risks and benefits associated with our treatment. And so this is going to be similar with services provided via video conferencing. But I think that it's particularly important to make sure that you, again, are really mindful in terms of documenting any possible risks to confidentiality associated with either the service that's being provided or any kind of file sharing. And, I think that the best way to ensure that the client is, effectively informed is to provide them with an informed consent in writing that kind of outlines any possible risks and what they might be, and then discussing that with the client and providing them with an opportunity to ask any questions or to share any or to hear of any of the concerns that they may have. Another consideration is of course, you want to make sure that where the person is receiving therapy is going, and where you're providing therapy is going to want to be in a safe and confidential environment. So ensuring that your cameras are placed in a quiet location and there isn't necessarily anybody in the background that can hear what you're discussing with the client, or there isn't anybody in the client's home that can hear them, or you also want to work to minimize any distractions So just because the client is receiving care at home doesn't mean that they're, ideally you don't necessarily want family members or children or pets like in the room that are potentially going to, interrupt the therapy. So you want to kind of basically create a setting that, mirrors what you would expect in a face-to-face setting. So a confidential room where a door can be closed, where there's, kind of minimal distractions. So that's all the information that I have. I think that, as a whole, video conferencing has become kind of a very common practice. And I think that we'll continue to see that be the case kind of moving forward. And it's provided a wonderful solution, not just to dealing with safety related to COVID, but also really ensuring that, more individuals have access to treatment. And so, I look forward to kind of learning more about, kind of new, technologies and programs and applications that really kind of provide solutions to, really making sure that we can provide continue to provide this treatment in the most confidential and secure way as possible. And that is all I have for today. So thank you so much for your time.
서울사이버대학교
상담심리학과